Hello guys, welcome and welcome to Meet Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. Today in this video we are going to discuss in detail about the important questions as well as the golden points which is taken from AIIMS Senior Nursing Officer exam which is conducted on 2nd July 2023. Without wasting time, let's begin the session. And if you are new to our channel, please subscribe our channel. And if you like this video, please like it, share it, subscribe it. And for further notifications, please click on the bell icon. Let's begin the session. The first question is, the primary fever in malaria corresponding to the development of the parasite in the red blood cells comprises all of the following except. It is an except question. So here the key point in the question is, development of parasite in the red blood cells comprises of all except. So this is the key point, parasite in the red blood cells. So in which stage there will be parasite in the red blood cells, and they have given four options, that is relapse stage, hot stage, sweating stage and cold stage. And here the right answer is option A, that is relapse stage. See, usually the meaning of relapse is once the immune power is decreasing, again there is a chance for getting the disease, that is called as what, relapse. And it is nowhere related to the parasites in the red blood cells. Usually parasites in the red blood cells, it is commonly seen in hot stage, sweating stage and cold stage. So let's see the golden points. Different types of malarial parasites which is causing the malaria. So what are all the different types? Plasmodium falciparum, Plasmodium malariae, Plasmodium vivax, Plasmodium ovale, Plasmodium knowlesi. And which is most commonly causing malarial disease? Plasmodium falciparum and Plasmodium vivax. Among these Plasmodium falciparum and Plasmodium vivax, the most common one is Plasmodium falciparum. Okay, so other important points are, in this question we discussed about hot stage, cold stage and sweating stage. So I am going to explain in detail. So all these stages are the classical manifestations of malarial disease. So what are all the things happening in the cold stage? See, the person will be having feeling of intense cold and it lasts for 15 to 60 minutes and vigorous shivering will be there. This is the first point. And second one, followed by the cold stage, hot stage will be there, where the person will experience intense heat, dry burning skin, throbbing headache, and it lasts for 2 to 6 hours. So the cold stage lasts for 15 to 60 minutes, and hot stage lasts for 2 to 6 hours. And the last one is sweating stage. Here profuse sweating will be there, temperature will decline. Obviously if there is a sweating, the temperature will decrease and the person will be exhausted and weak, and it lasts for 2 to 4 hours. Okay, so all these stages are commonly seen in malarial disease. So cold stage, followed by that hot stage, followed by that sweating stage. So these are all the important key point what you supposed to remember. And the second question is, a 2-year-old child is brought to the pediatric OPD with the complaint of failure to thrive. On assessment, the nurse observed that the child less than 3 SD in the sense standard deviation as per the WHO chart, and mid upper arm circumference is less than 11 centimeter. What would the nurse suspect for this child? These kind of questions are very common nowadays in the NORCET examinations. So here in this question the key words are, the first keyword is the child less than 3 standard deviation, and second keyword is mid upper arm circumference is less than 11 centimeter. So based upon these two category only we are going to select this option. They have given 4 options like severe acute malnutrition, moderate acute malnutrition, chronic malnutrition and acute malnutrition. Let's see which is the right answer. See, answer A. What is answer A? Severe acute malnutrition is the correct answer. So why I have selected this? Let's see the golden points. According to WHO underweight standard deviation classification, this is the WHO underweight standard deviation classification. Okay, so weight for age up to 2 standard deviation is normal, and weight for age in between 2 to 3 standard deviation is moderate. So weight for age less than 3 standard deviation is severe. So in the question they have asked less than 3 standard deviations. So the person is in what? Severe acute malnutrition. That's why we selected option A. And also they have given about the mid upper arm circumference. See, mid upper arm circumference, here you can see very clearly. More than 14 centimeter is normal. 12.5 to 14 centimeter is mild to moderate muscle wasting will be present. Less than 12.5 centimeter, that is severe wasting will be present. And this one will be commonly seen after 5 years of age. See, between the age of 1 to 5 years, there will be little changes in the normal child's arm circumference. So above these 5 years, we can go for mid upper arm circumference. If you know these two classifications, easily we can select the answer. And here the right answer is option A, that is severe acute malnutrition. Our next question is, a patient was presented to the pediatric OPD with fever, malaise, corzia. Corzia is nothing but cold, which is commonly seen in chicken. Okay, that is hen. Fever, malaise, corzia, cough, conjunctivitis. There were small red spots with bluish white center and a red base located on the buccal mucosa, and the nurse document these findings. What are these spots called as, and what are these spot indicates are? So here the keyword is, there are small red spots with bluish white center and red base. Okay, so this is the keyword. Okay, and they have given 4 options, that is brushfield measles, bull neck spot diphtheria, Koplik spot measles, Koplik spots diphtheria. And here the right answer is option C, that is Koplik spots measles. See, small red spots with bluish white center and red base on the buccal mucosa. It is a classical sign of measles, and these characteristic features spots are called as what? Koplik spots. Koplik spots. Okay, red base, white, bluish tip. Okay, and seen in buccal mucosa. Okay, fine. So let's see the golden points. See, some other points are also mentioned here, that is brush field spots. So where you will see the brush field spots? See, brush field spots are commonly seen in patients with Down syndrome, guys. So brush field spots are gray, white or brown spot around the iris. You can see this is the iris, right? So here you can see around the iris there is a gray color is present, right? So if gray color is present around the iris, it is commonly seen in Down syndrome, and this condition is called as what? Brush field spots, which is commonly seen in Down syndrome, not in measles. Okay, and the next one is bull snake. Bull snake appearance. See, bull snake appearance is commonly seen in diphtheria. What is diphtheria? It is an respiratory tract infection where acute nasopharyngeal problems will be there. Okay, so local edema will be present around the neck and it looks like a bull snake. So that's why it is called as what? Bull snake appearance. You can see here. Okay, so bull snake appearance is commonly seen in diphtheria. And Koplik spot, here you can see the structure of the Koplik spot, the characteristics of the Koplik spot: bluish white with red base in the buccal mucosa. Here you can see they are small bluish white spot with red background that is present in the cheeks, that is in the buccal mucosa. This is what they are asked in the question. That's why we selected Koplik spot measles as a right option. And the next question is, according to the Biomedical Waste Management of India, category 1 waste including the human anatomical waste should be disposed by. Category 1 waste, that is human anatomical waste. This is the keyword. So human anatomical waste, category 1 waste, if you see these two words, immediately you have to go for what? Incineration. Okay, so which is the right answer here? Option B, that is incineration. This is how we will be disposing the human anatomical waste, that is coming under category 1 waste. So golden points are, municipal solid waste can be treated by. See here, the first option is disposal in the municipal landfill, second one incineration, third one disinfection of chemical treatment, the fourth one is local autoclaving. So first see about the municipal landfilling. there are different types of municipal solid waste treatment. What are all they? Landfilling, incineration, waste compaction, composting, vermin composting, salvage procedure, and inaction. Let's see one by one. See, landfilling means usually the solid waste whatever collected, it will be kept in a separate land. It should be 100 meters away from the river, 100 meters away from the river, 200 meters away from the pond, pond, 200 meters away from the living area or highway, and 20 meters away from the airport. Okay, so these things are very very important. Okay guys, fine. So let's see one by one. So already you know about incineration. Incineration means in the temperature of about 980 to 1200 degrees centigrade, they will burn the disposal waste. Or if the disposal waste is not at all burning, its tendency is more, then they will be increasing the heat to 1200 to 1500 degrees centigrade. Okay, in the presence of oxygen. The incineration will be working in the presence of oxygen at 1200 degrees centigrade to 1500 degrees centigrade. Okay, so that is called as what? Incineration. And next one is waste compaction. What is mean by waste compaction? See, consider this is a huge number of waste. Okay, so by means of a machine, they will make this huge number of waste into a small box like waste. They will compress the waste and they will make like this. Okay, that is called as what? Waste compaction. And the next one is composting. What is composting? Organic waste generated. For example, what is organic waste? Fruits waste, vegetable waste. Okay, so all these waste are broken down by the small microorganisms like bacteria and fungi. This is called as what? Composting, and it is used as a fertilizer in plants. Okay, fine. The next one is vermin composting. In vermin composting, they are using the earthworms. It is a natural process of composting where they are using the earthworm to convert the waste material into compost. Next one is salvaging procedure. Very important. Many times this question asked in the examination. It means removal of the reusable substance from the waste. Removal of reusable substance from the waste, that is called as what? Salvaging procedure. And the next one is inertization. This is also very important. Many times they asked this question in the exam. Inertization means they are using the cement along with the waste and they will be filling in the land. It is used for the prevention of leakage of the waste materials in the soil or water. If you mixing the waste material with the cement, you are preventing the leakage of the waste materials in the soil or water. That is called as what? Inertization. Okay, apart from that, disinfection means we are using 2% glutaraldehyde, 70% isopropyl alcohol, 1% hypochlorite solution, otherwise 10% hypochlorite solution, in order to disinfect the materials like tubes, instruments, whatever it is. Okay, so these are all the important point what you supposed to keep in mind while you come across the word called as anatomical waste disposable or category 1 waste disposables. And the next one is question number 5. A patient with COPD has to be put on oxygen using a face mask. Identify the type of mask shown in the picture above. Okay, see here actually they have shown the picture of a Venturi mask. Okay, I forgot to add that. So here the right answer is option C, that is Venturi mask. Okay, fine. So in exam some other way also they will be asking the question accurate measurement or accurate percentage of oxygen delivered to the patient by which method, and here the right answer is Venturi mask. See, most frequently this type of question is asked in the examinations. Okay, so let's see the golden points here. So this is all about the Venturi mask. These things you supposed to memorize, that is 24 liter, 28 liter, 31, 35, red means 40, green means 60. So these things has to be memorized. Okay, and What are all the other golden points? Accurate measurement of oxygen can be given in the Venturi mask. Okay, and high concentration of oxygen. High concentration in the sense 95 to 100% of oxygen can be delivered to the patient by using only non-rebreathable mask. See, there are different types of mask like facial mask, partial rebreathable mask, nasal cannula. Among these, 100% of oxygen can be delivered to the patient only by using the non-rebreathable mask, and it is a one-way valve mask. Very, very important. Many times this question asked in the examination. And another mask is there is a rebreathable mask. Rebreathable means they are rebreathing the exhaled carbon dioxide. Okay, that is called as what? Rebreathable mask. In this rebreathable mask, see, mostly rebreathable mask and non-rebreathable mask both looks same. Okay, in rebreathable mask they are rebreathing the exhaled own carbon dioxide. Okay, so 1/3 of the patient exhaled air will be stored in the reservoir, and the patient will be rebreathing it oxygen as well as carbon dioxide together. Okay, and it is a two-way valve mask. Please remember that. In this image you can see very clearly the first one is partial rebreathing mask and second one is non-rebreathing mask. In non-rebreathing mask, the person will be inhaling only the oxygen. The oxygen will be going like this, and it will be stored in the reservoir bag, and while patient is taking inhalation, one way valve will be open and only the patient will take the oxygen during inspiration. This is called as what? Non-rebreathing mask, and only one way valve will be present and 100% of oxygen the patient has to be taken. Whereas here, partial rebreathable mask, the oxygen is coming here and it is going inside the reservoir bag, and patient exhaled carbon dioxide is also coming in the reservoir bag. So oxygen and carbon dioxide both will be present in the reservoir bag. That is 1/3 of the carbon dioxide will be present in the reservoir bag. Okay guys, so two valve will be present here. So this is partial rebreathable mask. Okay, which is more effective, which can deliver 100% of oxygen, that is non-rebreathable mask. Okay, and the next one is CPAP and BiPAP. See, very important one, CPAP and BiPAP. Mostly the CPAP and BiPAP, it is used for what? Respiratory distress syndrome, pneumonia, meconium aspiration, pulmonary edema, congestive heart failure, drowning patient. They has to be go for what? CPAP and BiPAP. Okay, even sleep apnea patient, they will be giving CPAP and BiPAP. See, there is a basic difference between these two things, that is CPAP and BiPAP. CPAP means continuous positive airway pressure and BiPAP means bi-level positive airway pressure. So in CPAP and BiPAP, the main difference is during inspiration and during expiration, the particular amount of air will be blows constantly to the patient. Okay, during inspiration also from the machine a particular amount of air will be coming to the patient, and during the patient is expiration, during expelling the carbon dioxide, that time also a particular amount of air will be continuously entering into the patient respiratory system in order to keep the alveoli open. Okay, during inspiration, during expiration, a particular amount of air will be continuously coming inside the patient respiratory system. Okay, so in order to keep the alveoli open, that is called as what? CPAP. Whereas BiPAP means, see, bi-level, two techniques are there. During expiration and during inspiration, there is a difference in the BiPAP. During inspiration, consider this is the machine and this is the tubings. During inspiration, a particular amount of air will be coming to the patient, and during expiration, the pressure of air which is coming from the machine to the patient will be decreased. Okay, whereas here the pressure will not be decreased. During inspiration, during expiration, the amount of air which is coming to the respiratory system, coming to the alveoli, will retain same. Whereas here in bi-level PAP, during inspiration, the pressure of air which is coming from the machine to the patient will be more, and during expiration, the pressure of air which is coming from the machine to the patient will be less. So that is the basic difference between the CPAP and BiPAP. Okay, so guys, if you want to get frequently this kind of previous year question paper discussion with the golden points, please follow us in Media Nursing Academy YouTube channel. If you have any doubts, if you want to clarify any topics, please drop your message in the chat box. We will be clarifying your doubts. So thank you very much for watching this video. Please share this video as much as possible, and if you are not subscribed to the channel yet, please subscribe the channel. Thank you very much guys.